Hi, so we got an article and it's talked about how there's a prevalence of pulmonary conditions in people who have been incarcerated within the United States. And it brought up tuberculosis, various ways of getting asthma, and other lung conditions such as cancers, and a lot of tobacco use disorders. So some of the things that go within the ICF framework for physical therapists is it talks a lot about the body structures and functions is like because of these diseases they have like a reduced lung capacity and they have weaker respiratory muscles, and sometimes because of the tobacco use and the prevalence of those things in incarceration environments, they have an increased airway resistance because of tobacco use and the environmental exposures. So even if like they personally aren't using it, like other people around them, there's just a higher prevalence of that. So they're exposed to the secondhand smoke. Some things that we can do as physical therapists is try and help with breathing retraining and diaphragmatic breathing, as well as it talks a lot about in the article how they had like social environment ways to help with pulmonary rehab, so that they had a group pulmonary rehab so that they could have less social isolation, which was another like environmental factor that was really inhibiting a lot of people's therapy, which I thought was really cool. So like group rehab like significantly boosted their numbers. So as a PT, we could keep that in mind as an environmental factor too, for a positive impact in a person's rehab. Also working on energy conservation techniques so that they don't have to work as hard. So like some things like COPD that never really go away, like we can help educate them on different energy conservation techniques so that they aren't working as hard or breathing as hard. So yeah, those are just a few, but those are the ones that really stood out to me that like I wouldn't have thought of as a physical therapist from this article. Just thinking about different environments moving forward on how to treat different populations was really cool. So